Greetings everybody, my name is Grace and we are from Group KK Seri Kembangan. Today we'd like to talk about inhaler technique. An inhaler is a medical device that administers medication to the lungs in an aerosolized form. And the most commonly used type of an inhaler is the metered dose inhaler, which in short we call it as an MDI. With an MDI, the medicine is administered in a metered dose, which means in a measured amount. And this saves the patient from having to measure their dosage every time they use it. An MDI is used to administer bronchodilators, anticholinergics, and steroids. The two major components of an MDI include a canister and a mouthpiece, also known as an actuator. And it generally comes with a dust cap to prevent contamination. As you can see in the photo on your right, there's the canister which holds the medication and a mouthpiece which is inserted into the mouth during administration.
Assalamualaikum and hi everyone. So I'll proceed to the next topic, which is how to use inhaler correctly. But before I start, I would like to inform that there will be a video demonstration. So I hope that we all can have a better understanding after watching the video demonstration later. So let's proceed to the next slide. First and foremost, the patient need to stand or seated upright in order to obtain the full dose of each pump. Then they can remove the mouthpiece cover. Next, they need to hold the inhaler in an upright position as shown in the figure below. For those who are having difficulty in handling the inhaler, they can actually use their both hands. Next, they need to shake the inhaler 3 to 5 times in an up-down motion before each puff, which means that each shake constitutes from top to bottom back to top again. Please note that if the device is being used for the first time, the patient need to prime it by pump the canister mid-air until an even spray is obtained. Later, they need to exhale slowly and completely through their mouth before holding their breath. Please do not exhale into the mouthpiece as this might push the medication more inwards, so they will not get the correct dosage later. Then, they need to slightly tilt their head and insert device into mouth with no obstruction to the mouthpiece. They also need to ensure that their lips are completely sealed to the mouthpiece so that there will be no leakage happen. However, please do not bite the mouthpiece. And then they can begin inhaling slowly through their mouth and simultaneously actuate the pump once. And continue inhalation for about 3 to 5 seconds until the lungs are full. However, there are some patients who are having difficulty in doing steps 1 and 2 simultaneously. So what they can do is that they can actually use a spacer, where this spacer will provide enough time for them in order to inhale the medication after pump the inhaler. Then they need to hold their breath for about 4 to 10 seconds, and it is recommended to leave the inhaler in the mouth while holding their breath. This is because to prevent any loss of medication from expiration. Then they need to remove the inhaler from mouth and begins to exhale slowly. After that, they need to wait 30 to 60 seconds before repeating steps 3 to 8, and this is only done if subsequent doses are required. Last but not least, they need to close the cap and keep inhaler in a dry place. So that's all from me. Thank you.
flow meter is the device used to measure how hard and fast you breathe out. This device is used to monitor asthma and also chronic obstructive pulmonary disease. Doctor will use either your personal best reading or expected value as the benchmark of the asthma control. The personal best reading is the highest reading that the particular patient achieved in a 2 to 3 weeks of period. The doctor will calculate the expected peak flow value according to the age, sex, and also height. The doctor will use the personal best peak flow rate to calculate the zones in your asthma action plan. So, the peak flow needs to be measured regularly to be useful. Record the score on a peak flow chart and see how they change over the time.
Now let's look at the technique of using a peak expiratory flow rate. So we must connect a clean mouthpiece to the instrument first, then ensure the marker is at D0. The patient should be either stand up or sit at the sit upright position, and ask the patient to take a deep breath and ask him to hold it. Place a mouthpiece in the mouth of the patient and seal the mouth PEFR with the patient's lip. Then ask the patient to breathe out as hard and as fast as he can and observe and record the reading. Repeat the process 3 to 4 times and record the highest reading.
So here is a picture of a peak flow meter. There are 3 main parts, which is the mouthpiece, an indicator where when it moves when you blow, and also a measuring scale. So next is on how to use the peak flow meter correctly. First, you must insert the mouthpiece and make sure that it is clean. Once it is connected, you must hold the peak flow meter level parallel to the ground and ensure that the marker or pointer is at 0. And then what you must do is that breathe in fully through your mouth before putting the mouthpiece in your mouth. And then you place the lips tightly around the mouthpiece and blow out as fast and as hard as possible. While keeping the peak flow meter level parallel to the ground, you can check the reading. After you have made sure that the reading is correct, you can repeat the steps from 2 to 5 another 2 more times. And then you can record the highest reading from the peak flow meter.
Hello everybody, I am Hong Tek and I'm here to explain about why do we need to take note of the peak expiratory flow rate. So the peak expiratory flow rate has to be measured regularly in order for it to be useful. So we measured the peak expiratory flow rate with the peak flow meter as shown by my friends in the slide before, and the patient has to record down the score for morning and evening in the peak flow chart, which is on the next slide. So in the peak flow chart, there's a specifically assigned green zone, yellow zone and red zone by the doctor according to different follow-up. So what happened is that the peak flow rate will be recorded and the patient has to take note whether it falls under the green zone, yellow zone or red zone. So if the peak flow rate is fall under the green zone, that means that the patient has a good asthma control. However, if it falls under the yellow zone, the patient has to follow the instruction written down by the doctor in the asthma action plan. However, if let's say the peak flow level is fallen into the red zone, this is an emergency and the patient should immediately attend to an emergency department or they should call for ambulance. So in conclusion, why do we need to do peak expiratory flow rate? This peak expiratory flow rate is in order to monitor and to watch the progression of the asthma control, and as well as to enable the patient to take early intervention just in case that the patient is in an emergency condition.
Okay, Simon, in terms of setting up the equipment, the important aspects are to ensure that the mouthpiece is inserted into the peak flow meter and to ensure that the dial is set to 0.
Thank you everyone for watching the video, and I hope that me and my team has explained about the clinical skills of using inhaler as well as the monitoring of peak expiratory flow rate well.